Children don't tend to come into care because everything has been going well for them. Most children will join us after they've experienced significant, long-standing adversity at the most sensitive time of their lives. That might include abuse, neglect, domestic abuse, parental mental ill health, substance misuse, chronic instability, exposure to violence, loss after loss, or significantly disrupted caregiving. Many have lived for long periods in states of extraordinary stress, unpredictability, or fear. This has a lasting impact on mental health and well-being if the right help isn't found at the right time. Research consistently shows that children in care experience far higher rates of mental health difficulties than children in the general population, and that they also face substantial inequalities across health, education, employment, and long-term well-being. There are estimates that about 45% of looked-after children will meet criteria for diagnosable mental health conditions at some stage, compared with roughly 10% of children in the wider population. This is one of the things ISP support tries to change because it's profoundly unfair and a deep social injustice. This poor state of affairs in the wider community is terrible, but sadly not very surprising. If we take a moment to think about it in a bit more depth, the children we care for have lived through far more challenges in their early lives than most adults will ever encounter in their whole lifetimes. And they will have had those experiences when they are rapidly developing, physically and mentally, at their most sensitive and their most dependent. Common experiences for our children include abuse, severe neglect, domestic or community violence, severe deprivation, chronic instability, repeated loss, persistent danger, adults being absent, severely mentally unwell, or using substances that make it impossible for them to parent. These are very impactful experiences. Another factor is that most of their terrible experiences will have been in the context of relationships with adults who were supposed to be the ones who made them feel safe, secure, loved and nurtured, and who helped them develop physically, emotionally, cognitively and socially. So you can see that our children's needs will be higher and different to those of children who haven't had these kinds of experiences. But without ISP services, they are also more likely to experience significant barriers when trying to access mental health support. Many services are simply not designed for children who may move around, have understandable mistrust in services, lack support networks to help them navigate systems, or need highly individual support rather than brief, manualised or group interventions designed around the average child. On top of this, many of our children will also have seen firsthand the impact of caring for adults in their family of origin who were really struggling with mental health difficulties or substance use, and they might understandably be really deeply fearful of becoming what they witnessed. So when we see children struggling emotionally, relationally or developmentally, those difficulties very often make perfect sense in the context of what they've lived through. Really importantly, trauma isn't just about what's happened to a child. It's also about whether they have had safe relationships available to help them process, regulate and recover from those experiences. Not having had the right support after intensely dangerous experiences dramatically increases the risk of suffering trauma symptoms in the longer term. For many care-experienced children, trauma builds up and impacts their development and leaves them feeling that they can't expect to be protected and that vulnerability itself is an incredibly dangerous thing. Entering care can also involve grief and loss, even when removal from home is necessary for safety. Children will very likely miss family members, communities, schools, pets, cultural connections and identities. Some children have experienced multiple placement moves or disrupted schooling before they reach stability. Children in care without the full support package that we offer might experience repeated relocations, which interrupts their continuity of care and can also isolate them from social and cultural networks, which can further have an effect on their well-being and development. Stability is so important in recovery, and that's one of the reasons ISP places such a strong emphasis on supporting foster parents through a specialist, multidisciplinary therapeutic network. We work closely alongside foster parents because supported relationships are one of the strongest protective factors that children can have. As we see it, therapeutic fostering is about helping the whole network around the child to remain emotionally available, reflective and connected, especially during difficult periods, not just giving the child therapy. We also have to recognise that some children's experiences and voices can become really marginalised within systems. Children in care are often underrepresented in research, disconnected from support networks, repeatedly relocated, or affected by intergenerational patterns of trauma, deprivation and disadvantage. Some may have complicated and very understandably mistrustful relationships with authority figures or helping professionals. This means that the evidence base around what works in therapy for children and services designed around that evidence often don't represent their specific needs. Thankfully, our specialist services are designed with our children's unique experiences in mind. Children develop emotionally and neurologically through relationships. When early relationships are frightening, neglectful, unpredictable, or disrupted, it's very likely to affect how those children understand themselves, other people, and the world around them. When care-experienced children have mental health difficulties, it's often the culmination of all of these intersectional disadvantages and their traumatic early experiences in combination. The good news is that if we address both with an integrated approach, we can have a profound and lasting impact on their mental health and their life chances.